Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
All right, everybody, this is what we've been waiting for. We want some medical advice. We want somebody who's powerful, and we found the right person. It's Randy Gross, and Randy is the CEO of Broward Health at Imperial Point, one of my very favorite hospitals of all, South Florida. So, Randy, good afternoon.
Good afternoon. Thank you for having me.
It's a pleasure. You are really what every CEO of a hospital should be: friendly, smart, very interested. And so let's start with just that. Tell us what is going on now with, are people returning to their jobs and to what they were doing before?
Definitely. And thanks for the kind words. And it's a pleasure to be here. Always look forward to this opportunity. So good to see you. And thank you again for coming out to visit Imperial. You had the chance recently to come see it firsthand. And one of the things I love about this place is it's really the people here. So when folks like yourself take the time to tour it and see it firsthand, you just feel it when you come to Imperial. So
definitely,
going back to your question on what's going on here, obviously kind of post-pandemic, right, is back to normal. And one of the things that we are trying to encourage Broward Health and Broward Health Imperial Point in particular, trying to encourage our community out there is get out there, right? Go out there and see your primary care. Go out there and see your specialist. Go to the hospital, do those tests, diagnostics, and procedures that we've all put off, because early detection is key, prevention is key, and that way we can get early diagnosis when there is an issue, concern, and then we're right there to help you and support you. So that's a big focus that myself, the medical staff, and our system overall is really trying to communicate to the community out there.
And let me just add something. I even went to my vet today, and they have outside service if you don't want to go in. But if you go in, you must wear a mask. Everyone must wear a mask. I don't think the dogs had to wear a mask, but everyone is being cautious, and then they can do what they always did.
Yeah, I think we've learned a lot through this pandemic, and definitely certain things are getting back to normal. But the new normal for us, I mean, right now we've opened visitation back up in the hospital, which is a great thing. We like visitation because having your loved one there when you're a patient is important. Now, obviously, the few COVID patients we have, there's heightened restrictions there, but your routine patient visitation is normal there. Patients and visitors, we do ask them to wear a mask. Obviously, hand hygiene and washing hands is important as it has always been. And it's great to see people are much more compliant. We've been talking about hand hygiene for as long as I can remember. But I think with the pandemic we've gone through, people realize how important it is. But definitely getting back to normal. COVID is a much smaller presence here. This past wave we had definitely hit South Florida hard. But we want to assure folks that hospitals, your doctors, and places, they're safe to go to. We know how to keep the hospitals clean and safe. We know the precautions to take. And most importantly, like I said, it's better to go seek the care you need, the diagnostics, the pre-screenings that you need. That's what's really most important.
And appreciate the healthcare workers. It's also very important to say thank you and smile and bring some flowers, whatever you can bring. But what I want you to say, though, and I always like to do this of all my guests, why did you become a hospital administrator? Did you always want to be one, or you want to be a fireman? A lot of little kids.
That's a great question. And, I tell folks, and it's true, I grew up in healthcare. My father was started out as a hospital administrator, a hospital executive his whole career. And I remember in career day, it was probably fifth grade. They asked me, and I think they were surprised when I said I wanted to be a hospital administrator. They're like, that came out of left field, right? Where did that come from? But I grew up in it. And I think one of the things that I've always enjoyed about it, respected and appreciated, is just the people side about it. And so one minute, you could be working with a housekeeper, environmental services, to a nurse, to a pharmacist, to someone like yourself, to doctors and others. So it's such a diverse field, new challenges every day. And it's just rewarding. When else do you get to be with people at a real time of need, when they're vulnerable, they're not their best? And so it's pretty awesome feeling to know they're trusting you to take care of when they're really down. So it's very rewarding. So I just love the aspect. I'm not clinical, But I love the aspect of working with our team here, working with our doctors and other clinical staff. My job is we're people architects, right? We want to make sure we got the right people in the right spot and give them the support, whether it's equipment, staff, the technical component, whatever they need to do their job and to do it well.
And you like to celebrate, and I'm so happy that you just finished celebrating cancer survivors. What was that all about?
Yeah, we definitely, in a tough, healthcare and the world year we've had, we always look for opportunities to celebrate. This whole month was breast cancer awareness. So we celebrate the achievements we have, the services we have. We really promote, as we mentioned earlier in this discussion, importance of screening, that early diagnosis, early detection. So Broward Health Imperial Point and Broward Health overall, we cover the full gamut for cancer. And like I said, it starts with your routine screenings all the way through treatment. And I think, look, I'm not a doctor, but what I've definitely learned in this field, it's every person is a little different, right? And how we approach them. It's not a cookie cutter strategy. And I think that's what we pride ourselves here within Broward Health is, like I said, from diagnosis to how that patient and family member needs to be treated both medically as well as surgically. And we cover the full gamut. We do a lot of, on the oncology side here at Imperial Point, we obviously do the diagnostic component, but we also do GYN oncology surgery. We have breast oncology surgery, surgical oncology, very complex cases here that we do. And when and if it's beyond Broward Health Imperial Point, we got the power of Broward Health through our employed physicians, through our community physicians that are on staff, and our supporting hospitals, North, Coral Springs, and Medical Center. So that's and day before yesterday, we had a wonderful event. It was a breast cancer survivor session where we had one of our own that was treated here at Imperial Point. She's a wonderful survivor. We had a butterfly release ceremony where she shared her story, and it was concluded by releasing these butterflies. And I tell you, I don't know if there was a dry eye in the house, myself included. It was very touching what she shared, and the confidence she had in our hospital and our system was great.
That's a lovely story. Wow, that's something that we don't hear often about. We always hear it's so sad this person had cancer, but to come to the end result here and have someone survive and then be so proud of it and happy, that's a great story. Well, I did have a question about physicians. So you have hospitalists and you also have outside physicians. Will you explain how that works? People have always asked me that.
No, it's a great question. And so we have hospitalists. They are internal medicine doctors. And what they do is they handle roughly 70% of the admissions into the hospital. Healthcare has changed over the last 20 years, where a lot of the community physicians, they work more, their primary care, for example, the primary care internal medicine physicians, most of them are very focused staying in their office. And so when and if their patients need to be admitted, many times they'll come in through the emergency department and they get admitted to the hospice group. So the hospitalists are contracted physicians with us primarily, and they manage the patient while they're in-house. And they're highly focused on hospital care to ensure timely, effective care, very focused on patient experience, looking at utilization to make sure the patients get the care they need. But they also, what's really important, what we emphasize, is they have close connection with the respective primary care physician in the community. Because right, he or she knows that patient the best. So we make sure there's good collaboration. Our hospitalists often go out in the community and meet with those community physicians just to make sure they know they'll have that rapport. So when we discharge the patient, they'll go back to that community physician. So that's a key distinguish. The hospitals do not have outpatient practices. They're solely focused on inpatient hospital work. But they really help us with our quality agenda, making sure no hospital acquired conditions and so forth. So it's really a key piece. But with that, we definitely a large array of community physicians that are on staff here. Primary care, internal medicine, but also your other specialists like cardiology, surgeons and whatnot. They're an integral part of what we do here at the hospital every day.
That's wonderful. And, we talk about cancer, but let's talk about heart because that's so important. And you have some innovations in your heart departments. What are they?
Right. So it's another celebration we did this month. So, a couple years ago, Broward Health Imperial Point started a STEMI program. It's the interventional cardiology that when and if you have clogged arteries in your heart, the ability to go in and reopen those vessels. Time, they say time is muscle. So it was key a few years back when we started that program. Well, fast forward, Broward Health has invested roughly $6 million into a brand new cardiovascular and interventional radiology suite. We took what was our old emergency department, which is adjacent right next to our existing ER. We cleared out that whole space, brand new construction, and built out a brand new state-of-the-art cardiology and interventional radiology. So all our cardiology services, it's a one-stop shop. We have the stress tests, echo, EKG. When you do your treadmill test and the doctor, they're testing your heart and your flow and your rhythms. But then we also have our diagnostic and interventional cath lab in there. So it's a one-stop shop. And it's important. Like I said, time is muscle. So when and if EMS is helping a patient out in the community, they can come here, come into the ER. We are literally steps away to our cardiovascular suite, and they can go right in there. So you'll hear door-to balloon times. That is key. Our team is there ready to support those patients to open up those vessels. We had our VIP grand opening last week, and this Tuesday we did our very first patient in the new lab. So it was a big celebration. The staff, the doctors, the vendors were there all to celebrate. We had a wonderful patient outcome. So it's just, we want to let the community know you got an amazing hospital right in your backyard that is state-of-the-art for cardiovascular and interventional radiology services. And once again, we got the power of Broward Health behind us for further care when and if that's needed.
My guest is Randy Gross, and Randy is the CEO of Broward Health Imperial Point. And I'll tell you something, he takes enthusiasm pills. And, I always watch Shark Tank, and you ought to get on Shark Tank and devise some sort of a pill for enthusiasm.
You're kind. People ask me, like, how do you stay enthused? I think the easy part is love what you do, right? Love what you do, be passionate about it, surround yourself with good people, and it's easy to be enthused. And I think that's what's always driven me. I've been in this industry for over 20 years, and that passion doesn't fade because, I love what I do, and we enjoy it. We're doing great things around here.
And I'm glad they found you at Imperial Point. That's good for all the families and all the people. But I want to get into something that everyone's thinking about, and that's the COVID problem. Tell us where we should be, what we should be doing, what's going on with that, Randy.
Sure. And once again, I want to preface, I'm not a doctor, I'm not a specialist, but being in this, in the hospital environment for the last year and a half, it's been an unbelievable year, I think year and a half for all of us personally and professionally. I'm very optimistic that we've made tremendous progress nationally, internationally, and definitely here in Broward. I think we've all seen the positivity rates have just declined significantly. I read an article just yesterday talking about Florida has the least positivity conversion in the whole country right now. So that's good. I mean, a lot of factors there, whether it's the vaccines. I think we've made much progress there. And definitely the hygiene has been a big factor in taking the proper precautions. So, I want to encourage folks to stay the course of those things, the things we've learned for that. Don't forget, but we are starting to see things open up more and more. That's, as I said, in the hospital, elective surgery, we're full force, and our healthcare providers, they know what to do. They know how to keep you safe. They know how to take care of you and your loved ones. So that's important. And so whether it's surgery, whether it's your routine visits, we're ready for that. And so I think we'll just continue to evolve. We're starting to see more community events. We're hosting community events within the hospital and the system to do education and awareness. We team up, for example, with EMS, fire rescue. We're hosting now hands-only CPR classes where community come here. So I share that with you now because it's a way to show the community that, look, hospitals and EMS are coming together and we're saying it's safe. They're hosting it here at the hospital. We want people to realize how important it is to partner with your community hospitals and learn these valuable skills. So it's safe, take the necessary precautions, but live your life and do those things.
And so, Randy, if someone wants a booster shot, though, they're not going to the hospital. They go to either a pharmacy or some sort of a clinic. Is that correct?
That's correct. Early in this pandemic, you saw Broward Health, second to none, I think, stepped up, and we gave out over 100,000 community vaccines. But the access was very limited back then, so it was what we needed to do. And Broward Health didn't even think twice about it. They made it happen and did an amazing job. Fast forward, access is much more prevalent out there. You see it where you can get your initial vaccine or your boosters out there. And so what we're doing is using our healthcare resources, our staff, our people, and other resources to focus on our ER, our surgeries, our inpatient, because we see the access for the vaccines and others. It's much more prevalent out there. So we've decided at this point, there's enough access points out there for folks that they have different options.
And the thing I want to talk about, the holidays are coming up, of course, Thanksgiving and then Christmas. Now, do you need helpers for Christmas? What do you do at the holiday season?
It's hard to believe they're already here, right? This year is a blink of an eye. Holiday season's important. I think, when you ask, what do we need? It's great to see our volunteer force is here back. So they're prevalent here at the hospital. So we always welcome the volunteers. They're a key point in this hospital and who we are at Broward Health Imperial Point. So when and if there's folks out there that want to be part of our volunteer organization, that's great. But beyond that, at this part of this season, what we're emphasizing, especially as we're getting towards the end of the year, is just we're trying to educate more, raise awareness. We're active in the community. So come to one of our community events. The hands-only CPR that we team up with Fort Lauderdale Fire Rescue EMS. We do that on the third Wednesday of each month here at Broward Health Imperial Point. You can go on our website, browardhealth.org/events to look at when we have those. You can register yourself. We're soon going to be doing Stop the Bleed classes. That's another partnership. So those are things towards the end of the year. It might not sound festive, but you know what? It's a great investment in you and the community by learning those things. So educate yourself, become aware, and do the proper screenings. And that's what you can do towards the end of the year to make sure you have a healthy end of the year and a great start to the new year that's coming up.
And also, I've attended every 2 months, and we've been doing it on Zoom now, where it's a community seminar, and everyone comes in, and usually there's a speaker. I have to think that's continuing.
Definitely. We try to look for a lot of different venues to, we have our CRC, our Community Resource Council, where we educate key leaders and others, active members in the community about Broward Health Imperial Point. They become almost our ambassadors, if you will. We want to make sure Imperial Point's not a secret anymore, right? We want people to know about our hospital, our services, our capabilities. And the more we get to know folks like yourself, we can constantly evolve and make sure we're growing and developing based on our community needs. So that's one option out there. We team up with homeowners associations. We got Miss Betty, who heads up the Imperial Point Homeowners Association, which is great. So we host them here often, sometimes virtually, sometimes in person. We host their meetings here. The Galt Mile, we're gotten much more involved in their homeowners association, and they've been a great partner virtually, and we look forward to that growing. So if your viewing population here, if they want us involved in their HOA, your committee, let us know, whether it's a doctor, whether it's a hospital nurse or other person. If we can help educate and raise awareness, we want to be there for you.
And I can't let you go without my being a cheerleader for your gift shop. And I've said it, I've said it in meetings. I've said it all the time. There are gift shops and there are gift shops, but there are no gift shops like the Broward Health Imperial Point. And I don't know who's the buyer, what they do, but you can go there and it's not very expensive. So when I try to buy my Christmas gifts or gifts for people, I wind up there at your gift shop. Do you ever go in there? Do you know how great they are?
Absolutely. And, during the pandemic, I'll tell you, it was tough because it was closed. It's run by our gift shop. And then the height of the pandemic, for a period of time, it was closed. So I can't tell you how wonderful it is to see it open again. The volunteers take a lot of pride in that. They run that, everything from ordering to running it day to day. And they do. They put a great array of items in there. Our own staff often shops in there, our physicians do, and community members. So we encourage, right? Community members can come into our gift shop. They can come into our cafeteria. We've got great food, great staff in there. And to your point, it's a great place to come shop and peruse and spend a few bucks.
Yeah, I was just gonna say, and the bucks are going into the hospital. It's a .org, so it's not like you're going and helping some entrepreneur, which is okay, but isn't it nice if you could go and the money goes into the hospital pot?
Definitely. Yeah, they love it. They take a lot of pride and they do a wonderful job.
And the other thing is, I think that you stopped your valet. Is that going to come back?
Great question. We did stop that, and of course, at the beginning of the pandemic and throughout, we'll reevaluate it. When you look at cost, the hospital, we're trying to get back to growth, and we got to look at cost and cost benefit right now, and we're not quite as busy as we used to be, so we're building that back. And so I think that'll definitely be something we continue to evaluate. It is an added cost for that service. And right now, we find that parking isn't as limited as it was pre-pandemic. And so, but we'll continue to reevaluate that. We did reopen our south entrance because during the pandemic, we limited ourselves to one entrance, and which it made it challenging for our rehab, which is up more on the south side of our hospital. So our patients had to walk too far. So now we've got a south entrance that's open. So people have close parking, close proximity. But as things get a little bit busier every day, we get a little bit busier, our emergency department, surgery and whatnot. As we get busier, we'll continue to evaluate that and definitely reintroduce that when needed. We have started at some of our sister hospitals, just not yet here at Imperial Point. It has not been as much of an immediate need.
Well, that's right, because your parking is very accessible to your front door, which is not true at the Broward General. And also, I can understand why it could be put off, but somebody asked me that the other day. The other thing, though, is it's very important that people understand where the hospital is located. It's very, very easily accessible. So why don't you explain how you can get there to people?
Great. No, I appreciate it. It's on Federal, it's tucked back. You can't see Broward Health Imperial Point right from Federal, but we are about a mile north of Commercial, just past about a mile and a half north of Commercial on Federal on the left, and great campus. It has a nice intimate feel. We have 2 medical office buildings on our campus with a variety of physicians, everything from primary to cardiology to surgery, and of course the hospital here. We have a wonderful rehab department and other diagnostic services here. So the goal is for patients to be able to come here with ease, park easily, walk in. It's not overwhelming. You'll just feel it when you come through here. People acknowledge you, they say good morning or good afternoon, they smile, they'll direct you in the right way, so you won't get overwhelmed. And it's just an easy place and a comfortable place to come get care. People often, when you're having this kind of care, it can be stressful, right? And we want to do our best to make people feel respected and treated like they're at home. And so that's what we're all about.
And I thank you. And since I am on the Broward Health Foundation board, I don't want to miss an opportunity to tell people. Now you've heard what one of our administrators thinks, does, feels, and there are 4 administrators, isn't that right? There's 4, Coral Springs and General and Imperial Point and North.
That's correct.
So they all function like this very well. So we urge you to donate. Now you can donate just if you have some extra pennies to, instead of putting in the bank, put it in, send it to them, or you can put it in your will, or you can make a trust. So I'm here. I hadn't intended to do this, but after hearing you're so enthusiastic, and I'm sure every CEO would be as thrilled as you. So let's get some more money there, because if they have more money, they can buy new equipment. They can buy the very best of everything. So it's a good opportunity for me to tell you, come on, we do need more money. We want sponsors, and it's a great way to spend your money. Isn't that right?
You're so kind. That's a nice surprise. I did not expect that. So thank you. We have the Broward Health Foundation, which is part of Broward Health overall, that really handles donations, and you can pick your hospital. And like you said, you talked earlier about what Broward Health did for the community with the vaccination. And let me tell you, it was unbelievable the amount of resources we pulled together to make that happen. But it's because it's who we are and what we do. And every day our system cares for those that don't always have the means. We do everything we can to give them access to care. And it's such a rewarding feeling to be part of that. So appreciate the opportunity. No donation is too small, and it goes to good use. It goes to new equipment, new supplies, and whatnot. So it's a great way if you have some extra money to consider. So thank you for bringing that up.
And Randy, I must tell you that I was one of the people who went and took advantage of the Broward Health for the shots. And I found people in Miami who couldn't get shots. And I asked them that these are people who were ill, and they offered them to come up. And everybody went they were so filled with compliments, the way everybody was so kind, all the health personnel. You all did a fantastic job. Yes.
Well, thank you. You know, people ask me what's some of your proudest moments in healthcare in my 20 plus years, and that's one of them. And it's something that I had very little, responsibility for it, but yet just knowing that I'm part of our organization that did that, and we sent many members from Imperial Point to help run it. So you just can't help but feel the pride, feel the joy. And it was such an honor to have a chance to do that. And it was a great way for people to learn who Broward Health really is. So thank you for that comment.
So Randy, thank you. This was wonderful having you on our show today. And we look forward to a lot more information as life picks up a little bit. I've been on a lot of Zoom interviews, and I even attended a Zoom funeral the other day because it seems that's what's happening. But I must say that it's been terrific having you on. I look forward to seeing you again, and more power to you, and just stay well.
Well, thank you for the opportunity. Stay healthy and well, and look forward to seeing you again around Imperial Point and in the community.
Just call me. Let me know when I can come and do something to help you.
You got it. Thank you so much. Have a great day.
Okay, everybody. Thank you for watching Andy. And Randy is the CEO of Broward Health Imperial Point, a great hospital.
Thank you so much.